everyone, welcome back to our channel Medical Coders Coaching World. Here is your tutor Bhuma Devi Chandrasekharan from Abu Dhabi. Hi, in this session we are going to see about the modifier, continuation of the modifier from modifier 50. Okay, modifier 50 is for bilateral procedure. What is meant by bilateral procedure? Bilateral means both side of the body. Lateral means sides of the body, bi is 2. So, both sides of the body is treated means that is bilateral procedure. This procedure, modifier 50 is added with the procedure code if the procedure is done in the same session. That means in a single session, if the procedure is done as a bilateral, then the modifier 50 should be added with the code. Okay, then modifier 51 is for multiple procedures. What is meant by multiple procedure? Multiple procedure means more than one or two procedure. More than one is multiple procedure. Okay. Multiple procedures are done. This modifier should be added only when the multiple procedures are done in the same session by the same individual means then we can add modifier 51 to the procedure code. That means the primary procedure code. Modifier 51 we cannot use modifier 51 with the add-on codes. If you are getting in your examination, if you are getting modifier 51 is added with any add-on codes, then you can strike out the code immediately because it's the wrong code. Modifier 51 should not be added with add-on codes, should not be used with the add-on codes. This is the very important guideline, you have to remember it. So, please remember this, modifier 51 should not be used with the add-on codes. If you are seeing some answers with modifier 51, if the added with the add-on codes, then the answer will be wrong. Okay. So, modifier 51 should not be used with the add-on codes. And what are the multiple procedure? All procedures are called multiple procedure? No, there is some restrictions. Okay. What are the restrictions? Any E&M services or physical medicine or rehabilitation services or vaccines are given in the same session by the same individual that are not considered as the multiple procedure. Other than these, if any treatment is given, then that is considered as the multiple procedure. Okay. 52 is for reduced services. Reduced services means the full length of the service is not completed due to some reasons or the patient's well-being, physicians or other healthcare professional is reducing some services of the treatment. So, it is considered as the reduced services. During that time, this modifier 52 can be used with the code. And modifier 53 is for discontinued services. Discontinued is different from reduced. Okay, reduced means the long term of the treatment is reduced. Some part of the treatment is reduced. But discontinued means one full term of the procedure is not completed. It is stopped in between the procedure. So, discontinued means modifier 53 we have to use. Due to some circumstances or patient health care, the doctors or other healthcare professionals is terminating the procedure in between. So, it is considered as the discontinued services. This discontinued services procedure modifier is not to be used if the procedure is terminated before the induction of anesthesia or surgical preparation. Modifier 54 is for surgical care only. Surgical care only means, as the name itself indicates, surgery only. Okay, which was actually the surgery was done by the one physician, and the preoperative, which means preoperative means before the surgery care. Postoperative means after the surgery care. Okay, preoperative and postoperative was done by another physician means the surgery codes are coded with modifier 54. And modifier 55 is postoperative management only. Postoperative means what? After the surgery, the care period is postoperative period. So, if the surgery was done by the one physician, but the postoperative care was done by another one physician means, then the postoperative management codes are added with modifier 55. Then modifier 56, it is for preoperative management only. The same as the postoperative management, surgery was done by one physician, Preoperative, which means before the surgical procedure, the care was done by another one physician. So, surgery was done by one physician, but the preoperative care was done by the another physician. So, in this situation, the preoperative management codes are added with modifier 56. Modifier 57 is for decision for surgery, which means an E&M service, any E&M service is given to the patient which will be entered in the decision for surgery means then modifier 57 should be added with the E&M codes. Okay. Then modifier 58, staged or related procedure or service by the same physician or other healthcare professional during the postoperative period. Postoperative period means after the surgery there will be a care. So, that is indicated as postoperative care. So, that period is known as postoperative period. Okay. If for a patient, if any treatment is given in the postoperative period, then the modifier 58 should be added to the procedure code. Any planned or anticipated procedure or the procedure which is more extensive than the original procedure or the therapy following by the surgical procedure which are done in the postoperative period means then it should be the procedure added with the procedure codes are added with the modifier 58. Any unplanned procedures are done in the postoperative period, that is which was done in the operating suite, then we have to refer modifier 78 for the suitable modifier which can be given to the procedure. Modifier 59 is for distinct procedural services. What is meant by distinct procedural services? Distinct procedural services are the services which are not related to each other is known as distinct procedural services. Okay. What is the definition for this modifier is two or more services which are distinct performed on a patient on the same date, then it should be coded with the procedure services are coded with modifier 59. This modifier indicates that the procedure are independent from the procedures performed on the same date. These two procedures are not related to each other. These procedures are different and independent from each other procedures. Okay. And this modifier 59 is not appended with E&M services. It should not be appended with the E&M services. This is the modifier 59 definition. Modifier 62 is for two surgeons, which means two surgeons acts as a primary surgeons for if there is any operating suite, two surgeons acts as a primary surgeons and they are doing distinct procedures, then that procedures, and if they are doing any add-on procedures also, then that add-on procedures also added with modifier 62. The two surgeons, if the two surgeons act as a primary surgeons and their primary procedures and their add-on procedures are added with modifier 62. In this one we have to note that if in these two surgeons any surgeon is act as a assistant surgeon in any additional procedures, then that additional procedures is not added with modifier 62. We have to refer modifier 80 or 82 for that additional procedure codes. Thank you for your support. Keep watching our channel. Don't forget to like, comment and share. Subscribe our channel and press the bell icon for our updates.